Hello everyone. The topic for this session is dural venous sinuses. The objectives are to learn about dural venous sinuses, classification, relations, tributaries, communications and clinical anatomy. And few questions will be given for the assignment. The dural venous sinuses are the venous spaces between the two walls of the dura mater. It receives the venous blood from the brain, its coverings, that is meninges, and the bones of the skull. The features of these dural venous sinuses are, it lies between the layers of dura mater. We have seen the dura mater is having the outer endosteal layer and the inner meningeal layer. So, between these two layers, these venous sinuses will be present and they don't have the muscles in their walls. They are lined only by the endothelium and they are devoid of valves in their lumen. It receives the venous blood and also the cerebrospinal fluid and it receives the valveless emissary veins which regulate the blood flow, and it communicates with the veins outside the skull through the emissary veins. Because of these communications, the pressure of the blood in the sinuses, it remains constant. Classification. So, totally there are 23 venous sinuses. So, out of which 8 are paired and 7 are unpaired. The paired venous sinuses are the cavernous sinus, superior petrosal sinus, inferior petrosal sinus, transverse sinus, sigmoid sinus, spinoparietal sinus and the petrosquamous sinus. And the last one is the middle meningeal sinus or middle meningeal veins. So, here we can see their location: sigmoid sinus, superior petrosal sinus, middle meningeal sinus, the spinoparietal sinus, inferior petrosal sinus and the cavernous sinus. The unpaired venous sinuses includes superior sagittal sinus, inferior sagittal sinus, straight sinus, occipital sinus, anterior intercavernous sinus, posterior intercavernous sinus and the basilar plexus of veins. So, the locations of the unpaired venous sinuses: the superior sagittal sinus, inferior sagittal sinus, the straight sinus, occipital sinus, posterior intercavernous sinus, anterior intercavernous sinus and the basilar venous plexuses. So, now we will discuss in detail about the cavernous sinus. So, the cavernous sinus is a large venous space situated in the middle cranial fossa on either side of the body of the sphenoid bone. The interior is divided into a number of spaces or the cavernous by the trabeculae. So, the cavernous sinus, they are having the floor, the roof, medial and the lateral wall. The floor and the medial wall is formed by the endosteal dura mater, whereas the lateral wall and the roof is formed by meningeal dura mater. So anteriorly it extends up to the medial end of superior orbital fissure and posteriorly the apex of the petrous temporal bone. It measures about 2 cm long and 1 cm wide. So the relations related outside the sinus and also within the sinus, that is on the medial and the lateral wall. So structures outside the sinus, superiorly it is related to optic tract, optic chiasma, the olfactory tract, internal carotid artery, anterior perforated substance. Inferiorly, it is related to foramen lacerum, the junction of the body and the greater wing of the sphenoid bone. Medially, it is related to hypophysis cerebri and the sphenoidal air sinus. Laterally, it is related to the temporal lobe with the uncus, and below laterally it is related to the mandibular nerve. So anteriorly it is related to superior orbital fissure, apex of the orbit, posteriorly the apex of the petrous temporal bone and the crus cerebri of the midbrain. Structures within the medial wall of the sinus includes the internal carotid artery with the venous and the sympathetic plexus around it, and the abducens nerve, the inferolateral to the internal carotid artery. The structures within the lateral wall of the sinus includes oculomotor nerve. In the anterior part of the sinus, it divides into superior and inferior divisions that leave the sinus by passing through the superior orbital fissure. Next is trochlear nerve. So, in the anterior part of the sinus, it crosses superficial to the oculomotor nerve and enters the orbit through the superior orbital fissure. Third one is ophthalmic nerve. So, in the anterior part of the sinus, it divides into the lacrimal, frontal and nasociliary nerves. Then the maxillary nerve. It leaves the sinus by passing through the foramen rotundum on its way to the pterygopalatine fossa. And the trigeminal ganglion. The ganglion and its dural cave that may project into the posterior part of the lateral wall of the sinus. So coming to the tributaries, that means the incoming channels. From the orbit, the superior ophthalmic vein, inferior ophthalmic vein and the central vein of retina. So, it may drain either into the superior ophthalmic vein or into the cavernous sinus. The tributaries from the brain includes the superficial middle cerebral vein, inferior cerebral vein from the temporal lobe. The tributaries from the meninges includes the sphenoparietal sinus and the frontal trunk of the middle meningeal vein. Now the communications. It is communicated or it drains into the transverse sinus through the superior petrosal sinus, internal jugular vein through the inferior petrosal sinus and through the plexus around the internal carotid artery, into the pterygoid plexus of veins through the emissary veins passing through the foramen ovale, the foramen lacerum and the emissary sphenoidal foramen, the facial vein through the ophthalmic vein, and the right and left cavernous sinuses through anterior and posterior intercavernous sinuses. So these are the valvulus and they can be passing on either direction. So in this diagram we can see the ophthalmic vein, the facial vein and pterygoid plexus draining into the cavernous sinus. So the factors helping expulsion of the blood from the sinus includes the expansile pulsations of internal carotid artery within the sinus and the gravity and the position of the head. Applied anatomy. The infection in the dangerous area of face may extend to cavernous sinus through facial and the ophthalmic vein that leads to cavernous sinus thrombosis. The other causes may be the bacterial infection that has spread from the sinuses, teeth, etc. They may reach the cavernous sinus and leading to the cavernous sinus thrombosis. The symptoms includes the bulging of the eyeball. The patient cannot move the eye in the particular direction. So that will be very painful. The drooping of the eyelids, the headache, the vision loss. So the cavernous sinus, the right and left cavernous sinus, they are interconnected by intercavernous sinuses. So usually in the beginning, even if it is unilateral, because of the intercavernous sinuses, the disease soon becomes bilateral. The pulsating exophthalmos. Sometimes in case of head injury, there will be a communication between the cavernous sinus and the internal carotid artery will form. So that will produce a pulsating exophthalmos. In this case, the eyeball protrudes and pulsates with each heartbeat. That's why it's also known as the pulsating exophthalmos. So now, superior sagittal sinus. It lies between the two layers of falx cerebri along the convexity of its attached border. It begins anteriorly at the crista galli by the union of tiny meningeal veins and ends near the internal occipital protuberance, and it becomes continuous with a right transverse sinus. So the superior sagittal sinus will continue as the right transverse sinus. Features: it is triangular in cross section and it communicates with the venous lacunae on each side. The arachnoid granulations project into its lumen which help in the drainage of the CSF or the cerebrospinal fluid. The tributaries includes the superior cerebral veins, parietal emissary veins, the venous lacunae, and occasionally vein from the nose. Applied aspect: the thrombosis of the superior sagittal sinus. The spread of infection from the nose, scalp and diploe to the superior sagittal sinus may cause its thrombosis. There will be a rise in intracranial tension and there will be a delirium and convulsion. The paraplegia of the upper motor neuron type of paraplegia will be present. Inferior sagittal sinus. It is an unpaired sinus present along the free border of the falx cerebri, particularly in the posterior 2/3 of the free border of falx cerebri, and it ends by joining the great cerebral vein to form the straight sinus. Inferiorly, it is related to the superior surface of the corpus callosum. The tributaries include the cerebral vein. Straight sinus, it is an unpaired sinus, lies in the median plane within the junction of the falx cerebri and tentorium cerebelli. It is formed by the union of the inferior sagittal dural venous sinus and the great cerebral vein of Galen. So, the union of the inferior sagittal vein and the great cerebral vein of Galen, they fuse together to form the straight sinus, which will be present along the median plane at the junction of falx cerebri and the tentorium cerebelli. It ends at the internal occipital protuberance and continues as a transverse sinus. Tributaries includes cerebral veins, cerebellar veins, arachnoid granulations which drains the CSF into straight sinus. Next is the transverse sinus. It is a large sinus and it is paired large in the transverse sulcus. It extends from the level of internal occipital protuberance till the beginning of the sigmoid sinus. The right is the continuation of the superior sagittal sinus. So, we have seen the superior sagittal sinus will be continued as a transverse sinus on the right side, and the left is the continuation of straight sinus. So, straight sinus becomes continuous as a left transverse sinus. So, here we can see the right transverse sinus, which is a continuation of the superior sagittal sinus, whereas the left is the continuation of the straight sinus. Tributaries: the superior petrosal sinus, inferior cerebral veins, the inferior cerebellar veins, the diploic vein, and the inferior anastomatic vein. So, here also the infection of the other sinuses may causes the transverse sinus thrombosis. Sigmoid sinus, it is a paired sinus, S-shaped, situated in the sigmoid sulcus in the posterior cranial fossa. So, that extends from the posterior inferior angle of parietal bone to the posterior part of the jugular foramen. It terminates by continuing as the internal jugular vein at the level of the jugular foramen. The tributaries includes superior petrosal sinus, mastoid emissary vein, the cerebellar veins, occipital sinus, and the diploic veins. Clinical anatomy: the thrombosis of the sigmoid sinus, that is secondary to the infection in the middle ear or the otitis media or mastoiditis. Another one is otitic hydrocephalus. So, the blood flow in a different sinuses. So, in this diagram we can see the blood flow from the various sinuses, and finally they will be draining into the internal jugular vein. That is, from the inferior sagittal sinus, it enters the straight sinus and reaches the confluence of sinuses, and from superior sagittal sinus and occipital sinus, they also reach the confluence of sinuses. From the confluence of sinuses, the blood moves towards the right and left transverse sinus. So, from the cavernous sinus, superior petrosal sinus and inferior petrosal sinus also, the blood reaches the transverse sinus. From the transverse sinus, it drains into the sigmoid sinus, and finally from the sigmoid sinus, it enters into the internal jugular vein. So, what do you mean by the confluence of dural venous sinuses? It is nothing but the meeting of the various sinuses at the level of internal occipital protuberance. So, the sinuses which are meeting in that particular place includes the superior sagittal sinus, the straight sinus, right transverse sinus, left transverse sinus and the occipital sinus. So now the questions for the assignments. Classify the dural venous sinuses. Describe in detail the position, formation, contents, relations, tributaries, connections and applied anatomy of cavernous sinus. Mention any 4 relations of cavernous sinus. Name paired venous sinuses, straight sinus, sigmoid sinus and superior sagittal sinus. Thank you.